Hello and welcome to a presentation detailing the barriers associated with dementia within a clinical setting. According to the Alzheimer's Association, dementia can be defined as a general decline in cognitive ability. It is a degenerative process that predominantly expresses itself through memory loss. The four most common forms of dementia include Alzheimer's disease, Lewy body dementia, vascular dementia, and alcohol-related dementia. A study released in 2012 by Mayeux and Stern found that Alzheimer's disease is the leading form of dementia. This is the easiest to identify through its manifestations within the body. In 2016, 1 in every 7 Australians were over the age of 65 years old. This age group holds very high risk for chronic diseases with copious comorbidities. Of these, 400,000 suffered from dementia. This significant portion of the population is expected to double by 2050 to just under 900,000 individuals, according to the Australian Institute of Health and Welfare. The following short clip by the Alzheimer's Society touches on the signs and symptoms unanimous to all forms of dementia.
It's time to talk about dementia. Symptoms of dementia can include memory loss, difficulties with thinking, reasoning or language, and some changes in behaviour. But dementia affects everyone differently. Some things to look out for are struggling to remember recent events or people's names, finding it hard to follow conversations or TV programmes, repeating yourself or losing the thread of what you're saying, difficulty concentrating, thinking things through or following instructions, feeling confused even when in a well-known place, becoming unusually anxious, depressed or agitated. If you're worried that you or someone close to you might have dementia, it's important to talk about it.
Feelings of confusion make dementia patients express the negative symptoms of the disease as they are vulnerable and agitated, not being able to familiarise themselves within the environment or people. This can deeply impede on medical professionals' ability to treat them as patients within the clinical setting. A recent study directed by Mr. George Grossberg found that 66% of patients diagnosed with dementia will express symptoms of aggression and agitation, with 54% of these patients exhibiting verbal threats of aggression and the other 42% instigating physical abuse towards themselves, other patients and healthcare workers. 20% of the beds in hospitals are occupied by a patient who suffers from dementia. Australia has an undoubtedly ageing population which is only on the rise. This shows that these numbers will place strains on the healthcare system due to the high level of care these dementia patients require. These outbursts of aggression has placed strain on patient and workplace safety within the clinical setting. Disturbances within the ward instigated by dementia patients has serious potential for implications causing harm to themselves and other patients, therefore affecting the overall safety of the workplace. According to a systematic review completed in 2013, the clinical significance of patient and workplace safety is undeniable. When patient and workplace safety is held in high esteem, then there is a reduction in the levels of adverse events such as medication errors within the hospital. There are higher patient and staff satisfaction levels. This translates into a better, harder work ethic. This allows staff to enjoy their jobs and want to stay in their position to build a stronger staff network. Lastly, having safety underpinning all work enables staff engagement as they are more willing to learn best practice off the leaders within the ward, such as the clinical nurse educator. A study conducted by Carmen Boozer this year details the negative effects poor safety can pose on dementia patients. Being in hospital for extended periods of time encumbers the mental ability of a patient as they lack their normal routine. This makes them feel institutionalized and makes it difficult to adjust back to their regular schedule. The lack of safety affects not only the patient but the family too. Higher healthcare costs heightened by length of stay and resource depletion, and a greater potential for adverse events to take place due to negligence. The more agitated and aggressive dementia patients become, the higher the likelihood of an adverse event to eventuate. Typically, to avoid any escalation, doctors will prescribe medication to somewhat sedate the patient to restrain them from this happening. According to a clinical trial in 2006, doctors were overprescribing atypical antipsychotics such as risperidone, olanzapine, and quintiapine to alleviate feelings of anxiety for the patient, although the patient did not voice feelings of anxiousness, but it effectively mellows out the patient so they become less high risk. This is both legally and ethically wrong, as it is effectively drugging the patient so they are not a threat to the safety of the ward, although polypharmacy does pose a threat. To legally use this method, it requires a restraint order signed and documented by the doctor. Therefore, leaders are needed to stand up and advocate for both patient and workplace safety in an ethical and legal manner. Within Nursing Standard 6, us as registered nurses are required to provide safe, appropriate and responsive quality nursing practice to all patients, including high-risk dementia patients. Newly graduated nurses can have a big impact by being a leader and making a change. This is attainable due to the fresh skill set and best practice they bring to the ward's skill mix. By following the New South Wales core values, these new nurses can cultivate positive change. Firstly, by collaborating with dementia patients' families to find out what comforts them to try and reduce outbursts of aggression. Having an openness to communicate with the dementia patient to reveal what they need to decrease their levels of agitation. Respecting that it is hard for patients with dementia to cope with their diagnosis, but to still care for them in the same way. And to also empower other staff members on how to appropriately care for a patient within your scope of practice. There are projects currently underway to try and help with the safety risk that dementia patients possess. These projects will help leaders facilitate a workplace conducive to patient safety. One project is the federal government, which has set aside an extra $200 million in the fiscal budget to be invested in dementia research. Similarly, the National Institute of Dementia Research was established by the Australian government to develop resources and helplines for dementia patients and their loved ones. Lastly, a framework called Action in Dementia was developed by New South Wales Health to try and set out goals from 2015 to 2019 to achieve when it comes to dementia patients within the clinical setting. Although the funding and research projects are very useful, they are strategic plans which can take years to attain. There needs to be more imminent resolutions of care for these dementia patients who are at risk of themselves and others. We need leaders to come together and make small changes within their wards which can ricochet into other wards. Some changes that I think could make a difference include getting extremely agitated patients to have a one-to-one special for some supervision, which could be an assistant in nursing. This is there to give the patient company and extra reassurance. It is also there to reduce the risk of falls, as these patients do pose a high risk for them. Also, having better staffing ratios for dementia patients as they require extra attention. Lastly, having a patient booklet which can be utilised to distract them and avoid the use of chemical restraint. This book can contain colouring mandalas, space to write journal entries, and also write down phone numbers of people they would like to chat to. I hope you were able to take something out of my presentation today. I also hope that I appeal to all of the learning styles through my communication techniques. For people who were visual learners, through my use of illustration, photos and animations, I hope that they got your attention. I also use very bright colours and different font size to attract the eye and keep the brain stimulated. Through narrating the PowerPoint, I could evoke the attention of the audio learner so they could listen and retain the important information from the slides. For the audience members who were learners through writing, I hope through my use of unambiguous language, bright coloured text and different fonts throughout you could learn from my presentation. And for the kinesthetic learners, through my use of moving images, YouTube videos and insertion of hyperlinks, I hope that you could have taken something out of my presentation today. Thank you for your time today. I hope you feel empowered to be a leader and make a difference in the safety of dementia patients within the clinical setting.